How does LVH show up on an ECG? Have you ever wondered how a thickened heart muscle can be detected through a simple test? Left ventricular hypertrophy, often called LVH, is a condition where the muscle wall of the left ventricle becomes thicker. This thickening usually happens due to high blood pressure, also known as hypertension. Understanding how LVH shows up on an electrocardiogram, or ECG, can be essential for managing hypertension and its related complications. When a person has LVH, the changes in the ECG can be quite telling. One of the most noticeable changes is an increase in the amplitude of the QRS complex. This means that the R waves, which are part of the QRS complex, appear taller in the left-sided leads, such as V5 and V6. At the same time, the S waves in the right-sided leads, like V1 and V2, can become deeper. This occurs because the thicker muscle of the left ventricle generates a stronger electrical signal during the heart's depolarization phase. Another change you may see on the ECG is a slight increase in the duration of the QRS complex. This indicates that it takes a bit longer for the ventricles to depolarize. Additionally, you might notice street segment changes, which can include depression and T-wave inversion in the left-sided leads. These changes reflected a delay in the repolarization of the ventricle, which is often associated with LVH. There are specific criteria that doctors look for when diagnosing LVH through an ECG. Voltage criteria include a tall R wave greater than 25 mm in leads V5 or V6. Alternatively, if the sum of the R wave and S wave is greater than 35 mm, this can also indicate LVH. Non-voltage criteria include an increased R wave peak time of more than 50 milliseconds in leads V5 or V6, along with the presence of a strain pattern. In more severe cases of LVH, left axis deviation may occur. This means that the electrical activity of the heart is directed more to the left than normal, which can be another indicator of LVH. Recognizing LVH on an ECG is important in the context of hypertension management. It suggests that the heart is under increased pressure, which can lead to further complications if not addressed. Hypertension is a major risk factor for developing LVH, and monitoring ECG changes can help in early detection. While an ECG is a useful tool, it should not be the only method used to diagnose LVH, especially in patients with hypertension. Additional tests, like echocardiography, may be necessary for a more definitive diagnosis. So, the next time you hear about LVH and its connection to hypertension, remember that an ECG can reveal important information about heart health. Understanding these changes can help in managing hypertension effectively and preventing complications down the line.